Hello, everyone. Thanks for tuning in to NCE Prep with Portia, Part 4 Treatment Planning. Treatment plans can look different depending on the company you work for or private practice. Although they may all look different, they all should have the basic core structure of a treatment plan. You start with the problem, then goal, objective, and intervention. Some companies may tell you to have an evaluation or a possible barrier section. Remember, goals are broad, objectives are measurable, and interventions are counselor actions. At almost every job I've had so far, we've talked about SMART objectives. It's just an easy way to remember that objectives must be specific, measurable, achievable, relevant, and time limited. Being able to link the diagnosis to treatment is key for the exam. I've listed some, not all, but some interventions you could utilize with each diagnosis. If you know more, add it to your study sheet. Remember to ensure that you're trained in specific interventions before treating. The intervention will also need to be developmentally appropriate. With children, you would use play therapy. Adolescents, you may use CBT, and with older adults, you could use grief work. You'll need to assess safety, establish diagnosis, develop goals, collaboratively select interventions, implement, evaluate progress, and revise if needed. If there is a suicide risk, safety planning always comes first. When it comes to treatment planning with co-occurring disorders, treat the condition that interferes most with daily functioning. Short-term versus long-term planning. Short-term consists of stabilization, skill building, and crisis management. Long-term consists of personality patterns, trauma processing, and relational themes. Documentation and evaluation. Remember that progress notes track objectives, goals may be revised, lack of progress requires reassessment, and refer when outside of scope, please. Here's your cheat sheet to review the day before your exam. Goals are broad, objectives are measurable, interventions are counselor actions. If there is a suicide risk, safety planning must come first. If treating co-occurring disorders, treat the condition that interferes most with the daily functioning. If treatment isn't working, reassess before changing the diagnosis randomly. As always, thanks for watching, and I'll see you in part 5.